Welcome back to the live music capital of the world, or perhaps better known as the capital of Texas, the city of Austin. We're following pharmacist and business owner Matthew Warnken in his quest to better serve his community by developing a comprehensive maternal vaccine program. We've heard a lot so far thanks to the counsel of nearby Tarrytown Pharmacy's Chief Pharmacy Officer, Rannon Ching. To recap, here are some of our key takeaways. Make sure that your team is aligned with what your vaccine program sets to achieve. Your website can greatly support patients' inquiries, so make sure it's thorough and user-friendly. And pairing with area doctors can go a long way, as Rannon can attest to.
Matt, I know you guys, your pharmacy is right in that medical park, right? So there's a lot of providers in your area. Do you know a lot of OBs? Do you have good relationships with them in the area that you can talk to them, or have you guys marketed a lot to them at all? Or?
We do have a few in the area, and we haven't done as much marketing to it, and that's kind of why I wanted to get your insight onto it, just because I know it's been successful here with y'all. So kind of what does that look like is one of my questions. Do you have anyone in particular that y'all have kind of been working closely with just to make that process, start to finish, become viable?
Yeah, we work a lot with OBs, specifically with our compounding lab, and we have a lot of good relationships with them. So I could give one of them a call and they could come over and talk to us.
And lucky for Matthew, Rannon was able to set up a meeting with one of the OBs that he's partnered with, Dr. Julia Gutierrez. Let's get her insight on the synergy created through the pharmacist-doctor relationship.
Hi, Julia Gutierrez.
Yeah,
nice
Matt
to meet
Warnken. You as well.
Well, yeah, I just wanted to thank you for coming in. Matt and I were talking, and we wanted to just pick your brain and talk to the specialist, and so we just wanted to chat with you.
Awesome, thanks for having me today.
I'm really looking forward to this conversation with our two pharmacists and our OB-GYN here, Dr. Gutierrez, and getting them to hear about working with each other and how they can improve that. It's going to be an awesome conversation.
Mm-hmm. So vaccinations are definitely one of the most important things in terms of prenatal care because prevention is key. Women who are pregnant are more likely to get illnesses because they're immunocompromised, and so it's really important to talk about it, especially right now in the winter. So right now it's flu season, COVID season, RSV season, and so we do recommend that everyone get the vaccines. What I usually do is initially at the first visit we talk about flu and COVID vaccine if it's in the winter months. And so we usually start those early around September, October to get their flu and COVID vaccines for the season. And then I always tell patients that, once you hit 28 weeks, you'll have a vaccine called Tdap that protects against tetanus and really more importantly, pertussis for the baby. And then usually between 32 and 36 weeks is when the RSV vaccine is recommended. And a lot of patients who've had children actually are pretty familiar with this because maybe their child's had RSV or a neighbor's kid has had it. And so most patients actually, when they hear that there's a new RSV vaccine available, most people really want it because they're like, oh, I can prevent that. My first kid had that, so with my second kid, maybe I can prevent my child from having that. And so definitely we start that conversation early for sure.
Do you come across some patients that are hesitant in getting these vaccines? Because I know for this, the RSV ones, it's relatively new.
Right.
So do you experience hesitancy with yours?
RSV is actually the vaccine I've noticed patients have the least concerns about, actually. So really, flu vaccines, we see a lot of hesitancy because people say, well, I've never had a flu vaccine in my life. I've never gotten really sick from the flu. I'll probably be fine. So sometimes I feel like it's kind of harder to convince them, hey, you need a flu shot. You need another COVID booster. And everyone's kind of like, oh, I need another one. I'm like, yes, it is recommended. Our immunity does wane. And the Tdap vaccine, most people do actually take that one. But RSV, I've actually seen the least hesitance. And I have patients asking for, can I get it soon? And I'll be like, you actually don't even qualify for it because you're due in July. So you don't need it in the summer, but your baby will have it after birth, actually. But we only do it between September and January for women who are between 32 and 36 weeks.
Okay, that's interesting.
Yeah.
Do you see a lot of patients even wanting it, even if they are having their baby in the summer, just because they feel like, well, why would I not want to protect my baby and things like that too?
So that comes up a lot actually, but the CDC guidelines do say we should wait between 32 and 36, and only in those specific months. And that's actually because the studies show that immunity can wane, and so it's actually better for the baby to get nirsevimab actually within the first 8 months of life for their first RSV season. So it's more effective for baby to get the monoclonal antibody after birth, as opposed to the mom getting vaccinated in the summer months, if that makes sense. There's just too much time elapsing between the vaccination and the first RSV season.
Yeah.
So it is it does come up, the patients want to get it. And I'm like, well, talk to your pediatrician, but really, ideally, you should probably wait for the baby to get it.
Yeah, sure.
Yeah.
This is really good information here. It's really nuanced, but there's some really cool information and facts in here that make taking care of these patients complicated, but why we need to have this conversation with each other.
And that was the conversation we had with our protocol physician, because we kind of help keep her like updated to say like, hey, this new vaccine came out, here's the indications, here's like the CDC guidelines. We're going to educate our staff so that you know that we're not going to be just giving an RSV vaccine to every pregnant patient in the middle of July.
Correct.
So once like the physician feels comfortable, then that's when we can say, all right. So a lot of it is like education with our team too, because now like any one of my technicians out there knows 32 to 36 between September and January.
Yeah.
So it's nice to have that extra kind of like peace of mind for the physician, because at the end of the day, they're helping generate those prescription orders.
So with this, specific maternal vaccine for RSV, are you comfortable with pharmacists in the community giving them? I know, especially since when the COVID vaccines began, everyone's kind of, at least in the US, has known that pharmacists do give a lot of vaccines. We give the majority of the vaccines, whether it's that or flu vaccines. Are you comfortable with the pharmacy population and confident that they're able to administer these?
Yes, definitely. We rely a lot on our pharmacists and our local pharmacies to administer these vaccinations, because most OB-GYN offices carry the Tdap vaccine and flu vaccines, but most of us aren't able to keep the COVID vaccine and RSV vaccines in stock. And so we do actually tell patients, at this gestational age, you should go to your local pharmacy and get the RSV vaccine.
What do you recommend because that's something that I feel like a lot of pharmacies are nervous about, of like, how do I even connect with doctors' offices, especially when they're large? Like, what do you recommend for what's a way for pharmacies or people to just kind of, because you guys are so busy and we don't want to bother you, but we also love having these dialogues and interactions.
I think just picking up the phone is really, really helpful. I was actually asking my nurse today, like, how frequently do you talk to pharmacists or pharmacy tech? Like, well, they frequently call about, medication updates, things like that. Did you mean to order this, this number of pills or things like that? But aside from that, I feel like we don't interact too much, and I wish it was more. Like, if there's ever concern about a medication, especially for a pregnant patient, or some alternative or things like that, I think just picking up the phone is really helpful. I think too, as a provider, knowing which pharmacies have which vaccines in stock, so we can send patients there, is really helpful. But just a phone call, a business card when there's a new local pharmacy opening up, things like that. Something I can give to the patient physical is like really helpful, I think. So they go home with something knowing, I can call this pharmacy at this number to schedule this vaccine.
That's really nice. That's something that's so valuable, I feel like, when you have those relationships with pharmacies and physicians and just like different practices.
Yeah.
For me, I feel like a lot of times, especially as like students and as we have pharmacy students or just like new pharmacists or even pharmacists who have been practicing for a long time, sometimes there's just like this nervousness of talking to calling the doctor or we don't want to bother you guys. And so
calling the pharmacist.
Oh, really? That's so funny. Yeah, because we're always like, oh my gosh, like they're so busy all the time, we don't want to bother them. And so so I think just having conversations like this and kind of breaking down like the barrier of like the phone and just having conversations, knowing that there's things that we can do to provide value to you and your patients and help take a load off of what y'all are having to do, but also know that there's ways that like you all will do whatever you can for your patients, and if there's anything that like we can do or that you guys can do, like we're really just working on the same team to care for our patients.
Yeah, we got to keep that in mind. That's right.
This is great. For the longest time, they've realized that they haven't wanted to bother each other. So this conversation is opening up this communication channel to realize how they want to be able to communicate better and how they can get on the same page and pick up the phone or send a fax and share the crucial information that they want to convey to take care of their patient.
So not only vaccinations, but we do rely a lot on our local pharmacies to help kind of get our patients directed to whenever they come to the pharmacy wanting a prenatal vitamin or wanting over-the-counter medication. So a lot of times patients will be interested in stool softeners, iron supplementation, and kind of depending on what insurance they have, they may not cover the version that we're sending.
Right.
And so it is helpful to kind of say, okay, this is the alternative or equivalent dosing, or this stool softener is safe from pregnancy. We provide a list of safe medications for all of our patients, but sometimes that list can get lost or it's hard to access online. And so I do think it's helpful sometimes when they come in, whether it's, for some over-the-counter medication or even if they have a cold or things like that and want to know which medications is safe. I think that's a really valuable resource to be able to go to the pharmacist and say, hey, what can I take for this cold or congestion that I have that's safe?
Based on the great information shared today, it's important to remember patients already have a high interest in vaccines and regularly ask for ones like RSV and flu. Doctors want you to have the conversation advocating for vaccines that are beneficial to your patients. Before having those conversations, though, make sure that both you and your team are 100% sure of the protocols. And above all else, don't hesitate to pick up the phone and call the doctor.
I would just say be open to, calling us, talking to us, getting together with other local physicians in the community for sure, just so we can kind of expand access to care for sure.
I really hope that Matt was able to talk with Dr. Gutierrez and learn specifically how a physician views this, how does an OB view partnering with a pharmacy, and how do they view their patient as a whole? Because again, if the ultimate goal for all of us is for that pregnant patient to have a healthy delivery, a healthy baby, using any available resource we have will only help benefit that.
So for him to, be open and kind of help teach me what they're doing so that I can grow off of it, since like I mentioned before, we've already kind of been doing it, it's just not that robust of a thing currently. And so to grow with that and then also have relationships with the OB-GYNs in the area, super important, and really excited to kind of get the ball rolling with this.
It's a great day here at Tarrytown Pharmacy. We learned a lot today from Rannon sharing some advice with Matt, and Matt being able to even share some things with Rannon. We heard from Dr. Gutierrez about the importance of working with pharmacy and our physician providers and the collaboration and the opportunity to really benefit our patient when we work collaboratively as a team. So with that, we'll see you on the next episode of Show Me, brought to you by the NCPA Innovation Center.
From the NCPA Innovation Center, we'll see you next time on Show Me.